The National Assembly Health Committee says it will question officials of the Kenya Medical Supplies Authority, that's KEMSA, and the Public Procurement Regulatory Authority on the reverse procurement of COVID-19 protective equipment adopted by the agency and which has left billions worth of the goods lying idle in its warehouse. Gina Kirori was at the warehouse and now reports that the terms have now resulted in a payment dispute between the agency and its suppliers.
A tussle between the Kenya Medical Supplies Authority and various suppliers of COVID-19 protective equipment has led to this. 3 warehouses full of medical equipment worth over 6 billion shillings purchased by KEMSA. The National Assembly Health Committee, which visited the warehouse on Tuesday, says this is a problem of KEMSA's own causing.
But KEMSA, out of their own wisdom, which we are trying to figure out at what point they arrived at the figure of buying goods worth 7.1 billion, decided to buy, outside what the ministry had authorized, they decided to buy items worth 7.1 billion, anticipating because of the numbers and the world figures that were happening with COVID, that they'll be able to buy those items and sell them.
It is emerging that these supplies were acquired through a process known as reverse procurement, in which KEMSA sent out commitment letters to the companies and goods delivered before payment. The committee says it will investigate this, as well as how. The first batch of items is of those that were allowed for procurement by the Ministry of Health, and which some of the money donated by the World Bank went into buying. And the second batch contains those that KEMSA procured from their own resources by their own wisdom, despite not receiving authorization from the Ministry of Health.
They have supplied, the items are here. They have not negotiated. So at what price are we talking about now with the current market prices? So that's one of the biggest dilemma, and would be wanting an explanation from the management, and why they have also taken so long to negotiate with the suppliers and they have already received their items.
The National Assembly Health Committee will now be looking into what the thinking was behind KEMSA's decision to purchase the 7.1 billion worth of personal protective equipment by analyzing the minutes of the meeting that yielded the decision. Gina Kirori, NTV, Nairobi.